Today we're going to be reviewing some quick tips and some pointers about whenever it's time to prone our patients. We're going to be talking to some people from surgery, and so they do it a little bit different than what we expect to see on the floor, but just some reminders whenever you are preparing to prone your patient on the floor. If your provider does give you an order and just says that we want to prone our patients, some reminders of maybe the positions that we need to be mindful of, how often we need to be checking for skin breakdown, and different things like that. So I'm going to hand it over to Dr. McCormick and Amanda for them to go over some pointers with us.
Okay, so starting out, first thing is just coordination between all members of the team. There'll be someone at the head of the bed, typically respiratory therapists, who will be in charge of the airway, and normally in the operating room that is the anesthesia team, and we usually do all counts and calls for any movements of the patients. So I'll turn it over to Amanda, and then once we flip the patient prone, we'll go over specific pressure points to check.
Okay, so let's go ahead and get started. The first thing you want to do, you want to make sure your bed is at the proper height to your thigh. You want to go ahead and take your bed rest down. If you have any lines or anything, you want to make sure if there are lines at the top, usually respiratory at the top will hold on to those lines. Okay. And Foley's and chest tubes, you want to hang down here at the foot of the bed. And they should go in between or on this side of the legs.
I'm gonna move the bed.
Yep. I'm going to go ahead and remove any pillows or anything at this point and go ahead and start taking off the patient's gown. Alright. The roll that you're going to use to protect the patient's genitalia, if they're a male, you can go ahead and put that on right now. You also want to make sure that the patient's arms are down to their side with their palms facing their thigh. Then you're going to take the bedroll with the chuck sheet facing the patient. Thank you much. Now you're going to take the bed sheet and you're going to roll it into your bedroll. Nice and tight, nice and snug.
When flipping the patient prone, it's always difficult to make sure all lines, monitors, everything doesn't get all tangled. So a lot of times what we do in the operating room is we'll take the patient completely off of the monitor. So ideally you can do that before this. You just have a 30-second to a minute lag with no monitors. The last thing you want to disconnect would be the endotracheal tube. So whenever you guys are ready, we'll move to the side. Are y'all ready?
Mm-hmm.
Okay, ready, 1, 2, 3. Okay. Now it's important, we're going to be flipping the patient prone to maintain a closed system and no respiratory droplets to get onto anyone that's performing this. You would clamp with a Kelly tube, then disconnect from the ventilator. Ready? 1, 2, 3. Ready, 1, 2, 3. Okay. Last thing to reconnect, back to the ventilator, and then you would remove the Kelly. This thing won't stay.
Okay, you really want to make sure you get out all the wrinkles in your draw sheet. Alright.
Okay, so starting from head to toe, we're going to go ahead and assume that we're going to be placing the patient's head lateral. So you would turn his head one side or the other with a pillow underneath. It's important once you're finished positioning to make sure that the spine is neutral. Right now we'll just continue, but we also want to maintain no folding of the ears. That'll cause pressure, as well as pressure on the down eye by the pillow. Next would be the chest rolls. Those need to go from the clavicle to the iliac crest. They're placed to prevent abdominal compression and also improve lung compliance. As far as the arms, we're going to place them on the sides for now, with palms facing inward to minimize ulnar nerve compression. You would need to protect the genitalia, as Amanda talked about, in a male. Also, with the chest rolls, females' breasts need to be medial to the chest rolls. Next, we would place a pillow underneath the feet with padding underneath the knees. And that's to maintain a mild flexion at